Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, subscribe, leave us a comment, and let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, it is my very great pleasure to welcome Jacqueline Clancy out of South Carolina. Jacqueline is a registered nurse. She's wound care certified. She's a legal nurse consultant. She's an innovator and designer. I think that's what I'll call you.
Thank you.
So, welcome, 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 Jacqueline.
Thank you for having me.
My pleasure. Let's start with why you're a nurse. How come?
Oh, wow. I really like the science behind things to begin with. And my first job ever as a 14-year-old kid was as a medical assistant in a physician's office. So I got very early exposure to the field. And then when I was in high school, I actually was able to graduate early. I started high school a year early. So I was the youngest in my class. And then I had all advanced placement classes. I had all of my credits, and my parents wouldn't let me graduate early. So I looked into the trade schools that were available because I was kind of getting bored with what was going
Yes.
on, and they offered LPN. So I did that in my senior year and absolutely loved it, and then took it from there.
Okay, so you had all of this early exposure, and you go to LPN, you become an LPN pretty young. How did that challenge you?
Um, I remember I remember being an 18-year-old kid as an LPN already taking
Yes.
charge of my unit and saying to one of my mentors, I just graduated high school, but I feel like I'm still in high school the way everyone acts around here. So I think that was a little surprising to me. I guess I
Yeah.
expected adults to be more adult-like. But after I kind of got over that snafu, I just was super interested. I loved the patients. I loved taking care of patients. I always had a knack for being efficient with high quality. And it once I got the knack of something, if I could teach a colleague or someone else how to do something that would make their lives easier and their patients happier, I was always game for that. And that's kind of been the footprint for my whole career.
As you're talking there, what I'm hearing, what I'm getting is that I was excited about this thing.
Oh,
So what kind of areas did you work?
I started off doing long-term care as an LPN and was working through doing my RN. I did subacute rehab and a dementia unit for a little bit while I was there. Then I also at the same time was doing home health. And then once I got my RN, I wanted to get greater exposure. So I moved on into the hospitals and worked as a staff nurse in a telemetry unit. Then became an assistant nurse manager of the telemetry unit. And then that's where I started asking a lot of questions. Like, how come every time my patient codes, there's never an ICU bed? And no one could really answer that question. And it was right at the precipice where patients never held in the emergency room at that point in time. There was never admitted patients, and it was just getting over at that tipping point. And they said, we think that healthcare, due to predictive modeling, is going to rip open with the aging and people living longer and the more chronic illness. And I'm like, okay, this doesn't seem like a challenging position to me to go do bedboard. It's more of like a puzzle, but
Yeah.
I'm game for that. And then I remember the first time an emergency room patient was holding for a bed, and I would not leave that facility, that hospital, until that patient got a bed. And then fast forward a few years later, we had, I think, up to 80 admitted holds in a
Oh,
trauma center. Yeah. So the landscape of healthcare drastically changed there.
and so you have designed an interfacility transfer center.
Yes. So
How exactly does
bedboard,
it work?
yeah, bedboard changed into logistics. There were no more beds to assign, so it became collaborative working with the team. and all of the milestones throughout, whether it was labs, physical therapy, getting radiology tests, OR, cath lab. What can we do to help the patient progress and not be delayed due to our inefficiencies? We were able to build that hospital up and to become a trauma center. Cardiothoracic surgery was onboarded during that time, and then we wanted to become a transfer center. And I was afforded that opportunity to build it basically the way I wanted and do all of the research. So I researched across the country, all of the top transfer centers, all, including those in my own health system. And I felt like they had some good structure, but there were a lot of gaps and a lot of opportunities for improvement across the board. So I
Yeah.
said, okay, well, I know what's not working. Let me see if I can innovate and see what we can do to shave some of this time off. So overall, on average per transfer, we were able to shave over 6 hours off with the new model that, I created collaboratively, of course, with the
Yeah.
physicians and nurses and administration. But that was a great feat. And then I was afforded the
Yes.
opportunity to take that model and put it on steroids over the largest health system in New York.
Awesome. Awesome. I love it. I love it. I love it. And this is what I think probably this is one of the things that thrills me about talking to nurses because this is so much what we do. We see a problem and we're like, just move out of my way and just let me fix it because what you've been doing is just going round and round in circles.
Right. Which it happens to be the definition of insanity, doing the same thing over and over and expecting different results.
Exactly, exactly. I love it. I love it. I love it. I love it. And so you're also a legal nurse consultant.
Yes.
And I see that you say you specialize in delay of care.
Yes.
Do you see a lot of that?
Yeah, that's the bulk in some way, shape, or form, even in falls. A lot of times when their patients are falling in a either
Mhm.
acute or a post-acute facility, there's something organic happening that gets missed. And should that had not been missed and interventions been in place, that could prevent a lot of negative outcomes.
Yeah, yeah, yeah. That could have prevented a lot of negative outcomes. And unfortunately, the first negative outcome leads to a second and a third and a fourth negative outcome.
Yeah, the Swiss cheese model.
It's- Exactly, exactly, exactly. So, nursing life per se, what do you think you wanted to change?
What do you mean, like then or now?
Now, going forward, I mean, now we're talking about lots of things. Now, many things are talking about now. We're talking about burnout. We're talking about people leaving the profession. We're talking about people who have entered the profession who were educated during COVID and feel the gap. And we're talking about nursing trying to stand up now as a community for ourselves. We're talking and looking for more better recognition. We're talking about nurse reimbursement and all of that. So what do you think you would like to see change?
Well, what I would like to and be an active participant in moving forward is protecting nurses.
Mm,
Um, Especially now that I'm in the legal arena, I see a lot of nurses getting named in lawsuits, and I can immediately pick out, although this person may have had some failures, that's not where the buck stops because it's not a person issue, it's a process issue. So starting right, already started since I opened my own firm,
yeah.
regardless of what side I am, I'm always looking to ask myself this question, is this a person issue or is this a process issue? And identify that. And I like to think if I'm on the plaintiff side and I'm hashing everything out, I specifically do it so it can almost be used as an action plan to prevent the next negative outcome. Also,
Mhm.
I've been toying with the idea of when I'm reviewing these lawsuits specifically involving nurses, I wonder what the circumstances were. I wonder what the nurse patient ratio was. I wonder how many incidents or codes or elopements were that day. I wonder if there's a monitor tech, if it's a telemetry required floor or higher. And unfortunately, none of that is currently part of the chart. So I don't know that we will get that because it's a conflict of interest. for some
Yeah.
of the entities to make that visible, but I'm working on a plan behind the scenes to give nurses a tool to
Yeah.
themselves with.
Yeah. When you can identify, I was going to ask you, what do you see as the biggest pitfalls though for nurses in this? Because from my observation, and I'm not into the legal aspect of it, but from my observation, I think a lot of it is incorrect or incomplete documentation.
Oh, yeah. Incomplete documentation, conflicting documentation with previous notes, and lack of escalation. So, as you're reading through, you can almost feel the emotion by the verbiage of someone noting something that they don't feel all right with. It may not be an event yet, but they have that, nursing intuition, and
Yeah.
they inform someone, and that someone is not, whether it be a physician or an LIP, is not acknowledging or saying something like no new orders, or not giving
Mhm.
them the order they were really looking for. And I think the buck stops there. And I have to say, one of the things that my health system I was with for almost 2 decades was very good at is they utilize something called team steps, which is military based, which
Okay.
empowers people when they have a question that challenges care to move on and escalate to the next level. They script you to say whether it's you're cussing, I'm concerned, I'm uncomfortable, this is a safety issue, and really red flag. And if that physician, regardless if they're the CEO, the VP of surgery, the number one bringing in of outpatient surgical, doesn't matter, you're able to and protected to escalate that concern. So I see a lot of that, and it's a shame because they were on the right track, and then it looks like due to hierarchy, they just let it go, even though their gut was telling them differently.
Yeah. And in many instances, even if they were willing to pursue, they've got so many other fires to put out that, like, all right, I got to deal with this other thing. Yeah,
Right, right.
yeah. I see that happening. What would you say? Well, what is your vision for the next 10 years or so? I see we have so much happening, not just in nursing, but to me, it affects nursing. This whole blow up in technology. We talk a lot about things like climate change. We talk a lot about every time you turn around on the news, there's another school shooting. There's so much increased violence and all of that. How do you think it affects us and how we deliver care? Because to me, we are just gradually raising the adrenaline level of the population. We're now, from my perspective, as a population, our adrenaline is somewhere up here constantly. How does that affect us and the way we deliver care to our residents? How will it change it, do you think?
Living day to day like that certainly increases your cortisol levels and keeps you in a fight or flight mechanism, and that is meant for literally life threatening situations. But due to the way we live our lives, and especially healthcare providers and nurses that are bedside givers of all, not just medications or treatments, but kindness, love,
Yeah.
empathy, all of that is pouring out of your own personal cup to help someone else. So what I'd like to see is a strong vein for advocacy for nurses, seeing more nurses in the political arena so they actually have a voice that gets documented and recorded and counted. And self-care is so important. Caretakers take care of everyone except for themselves, and you can't pour from an empty cup. It's as simple as that. And unfortunately, it took me over 4 decades to realize that in life. But I'm hoping I'll be able to share that with some newer nurses to prevent them some of the hardships that myself and many of my colleagues have encountered over the decades.
Yeah. As you say, it took all that time, but you're talking about 4 decades. I can talk about 4 decades as well. And I go back and I realize when I think of that is that my education anyway, focused on never focused on anything about me. and it always focused on what I can do for others. And that's not a bad thing, except that you can't just leave me out of the equation. So the fact that it took you 4 decades, it took me that long also because I think as female, that's what we're expected to. As moms, that's what we're expected to. As nurses, that's what we're expected to do. Nobody anywhere said you gotta look after you.
That's right. It's a big omission, without getting too deep in it. I think there's a few things, and even starting at a young elementary, middle school, high school curriculum level that can be omitted. And some of these like life skills should be
Yes.
inserted.
Yes, yes, yes. Particularly and I guess that's why, as I preface the question by talking about things like that, because in retrospect, my desert child was just totally carefree. We had no such thing as practicing a lockdown drill or, you know, so those skills, as you say, need to be introduced along with these other things but we're digressing a little bit. So you mentioned self-care. What do you do for self-care? What do you do to take care of you?
Oh, it all comes down to daily habits for me. And I am a regimented person. So I kind of make a contract with myself where it's on my calendar or at least on a post-it note, at least the night before, or I try to schedule out. I wake up and the first thing I do every day is gratitude. Every
Mhm.
single day, I do some affirmations, read some good positive quotes, and then I move on to either working out right after that, or I work out later on after the workday is finished for myself. The gratitude and working out are non-negotiables. Then moving forward, one thing that I learned through my own mentors is when you're meeting a lot of resistance, it's time to push away. When I was in healthcare for a long time, and especially advancement in more of the male dominated areas,
Yeah. Mhm.
healthcare, it's, nose to the grinding stone. And if you're meeting resistance, just push it in harder. And the expectation is you will have blood, sweat, and tears in order to elevate. And I needed to do that in order to make an impact because I desperately wanted to change some of these gaps that I was seeing so flagrantly.
But you mentioned gratitude though. Um, and as you talked about, starting each day with gratitude and that it's non-negotiable. I connect that with your creative juices, your designing juices, because to me, honestly though, I find that people who start the day with gratitude, somehow it releases all of their and creative juices. It brings in all the ideas. It leaves space for so many things to happen. So I'm glad you brought that up when you talked about self-care, because when I talk to people a lot about self-care, and I speak about it to every single nurse I speak to, because I feel like we need to articulate it to do it. Um, some of that gratitude thing does not always come out. So thank you so much for articulating that.
Yeah, absolutely. And, just like I'm scheduling my tasks or my appointments with attorneys, depositions, trials, etc., I'm also scheduling some little treats there in between. So for me, I like to get my nails done, get facials, get a massage. So I'm making sure I'm getting those down. I'm someone who leans more towards working too much than lacking the motivation to work. So
Yeah.
nobody escapes scot-free and it is perfectly balanced, right? So I have to
Right.
make sure I get that time on the calendar so I'm not working myself into into exhaustion.
Yeah, yeah, yeah. And that's true. You sometimes you really actually have to write that in, because otherwise you're not in the equation at all. What would you say that you've done so much? What would you feel like is your biggest achievement so far?
Oh boy. It's a tie. Setting up that transfer center and being able to be a change agent and a
Yeah.
transformational inspiration at a C-suite level, and offering a way to do things that is not the norm or not the status quo or not, well,
Mhm.
we've always done it this way sort of thing was really a challenge. And that was meant hospital by hospital, C-suite by C-suite, specialty by specialty. So,
Yes.
that was a little grueling, but it was great. And we got really, really great collaboration with that. So it's a tie between that. And then I would say, opening up, deciding to be an entrepreneur and opening up my firm and venturing off on my own.
Awesome, awesome. I think, and that is one of the big things about nursing. It fits you to do so many things. It gives you skills that are so transferable.
Absolutely. Never in my wildest dreams did I think I'd be using the skill set of home health and long-term care and subacute rehab from the beginning of my career, even working in the doctor's office for 5 years. All
Yeah.
of that comes back and I see it appear. And, I remember everything like it was yesterday. I'm like, wow, I wish I could go back and tell the 18-year-old version of me, hey, everything you're doing in nursing is going to be useful for you. And you're not even going to believe how.
Yeah. 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 Indeed. Indeed. So, having had all of this experience, and especially as a young person, what would you tell a young person who wants to be a nurse?
Ooh, that's a tough one. I would say that, they absolutely have to be in it for the love of the field. Because if you're going into it thinking, it's an easy way to make a few fast bucks, you are going to be dead wrong and a huge mismatch. And not many positive things will come for that. So if you are looking to go into this career, you have to really be a lover of the people and wanting to help them. And I think it's really important to know you're going into a big gap of broken system across the board. And I think the expectation really should be at this point, what are we doing to fix this? And the exception of layering on the same on top of the same
Mhm,
is no
mhm.
longer acceptable. When I used to speak, I used to parallel it to you having a festering infectious wound, and you have the first dressing on top. And instead of getting in there and doing a washout and a
Yeah,
debridement,
and
you just take
debris.
another dressing and you put it on top. And you continue to do that over decades, and then you wonder why you're an amputee. That's,
Yeah.
we need a wash.
Yeah. Yeah, 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 yeah. And and that's not so that's a good analogy. I don't know how easy it's going to take us a little while and a lot of probably even a lot of brute strength to get that done, to get back down to that wound, because especially now that healthcare systems have become conglomerates, and it's nurses are somewhere, um I don't know where on the level of, as is evidenced by the fact that we are included with the band-aids. Right?
Yeah.
So it's going to be a little bit difficult, but we can do this. We can do this. What now? Um, well, we were just talking about challenges and whatever, but what do you see as a challenge for the average person coming into, let us say, any institution and connecting with nursing? Our vision, the public vision of who a nurse is so different from the actual what a nurse is. How do you see, can we get this to connect better?
That's a great question. I think we have a very strong foundation in of the fact that we're the number one most trusted profession. And I forget, I don't want to misquote, but I think it's like something like 10 or 20 years straight.
In a
So
row.
we have the trust in an extremely distrustful world. So, I'd have to spend some more time and digest on that, but I feel like that's our building block right there.
Hmm, hmm.
Transparency and trust. And
Yeah.
then the data can speak for itself. I'm always an advocate of letting data speak for itself because it's louder and it holds no emotion and you can't refute it.
It's like DNA. It's there. Jacqueline, I can't thank you enough for this conversation. And before we go, is there any word you'd like to leave us with?
Yeah, nurses, take care of yourself. Do not put it off. If not now, then when? No one else is going to advocate for you because everyone else is used to you being the everything. Caretaking
Yeah.
at work, coming home, caretaking at home, caretaking for your neighbors. Everyone who knows a nurse is always like, what's this rash? Do I need stitches? Do I need antibiotics? Take a fraction of the amount of time you invest in other people and put it back into yourself. And if you're at such a state of burnout where you can't even fathom that, then rephrase it in your mind and think of it, I can't continue to take care of people to
Hmm.
my best of my ability unless I start investing back in myself, because it's like a bank account. If you keep taking out deposits and you're not putting any deposits in, you keep taking out withdrawals rather, and you're not putting any deposits in, you're going to be bankrupt.
Yep. I spoke to one nurse some time ago who, to me, put it very well, and it's stuck in my mind because she says she does not pour from her cup. She does not pour from a full cup. She pours from the overflow,
Smart.
and I think that's huge.
Oh
I think
yeah.
that's huge. And
That
I
would be
and,
the
and
nirvana state of nursing.
yes, right. I was about to say I wonder what it took to get there because getting to that stage is not it's not an easy thing.
Oh no, that's a lot of self-work right there.
Yeah, yeah. Jacqueline, thank you so very, very much for this conversation. It has been so enlightening. I have been so thrilled to talk to you.
It's been my pleasure. Great conversation.
All righty, have a great day.
You too.
Okay. And friends and followers, before I forget, join us next time as we talk to another nurse as we showcase nurses from around the world to the world, one conversation at a time.